Hello everyone. Today in series of Docplexus KOL interviews, we have with us Dr. P.C Manoria. He's a director of Manoria Heart and Critical Care Hospital in Bhopal. He's been the ex-professor and HOD of GMC in Bhopal. He's also been the past president of CSI and API. Thank you so much, doctor, for the interview. So let's begin with the first question. What are the limitations and benefits of statins?
See, statins are an integral part of therapy for patients with lipid management for ASCVD. Statins decrease LDL cholesterol by 1 millimole, which is equivalent to 40 milligrams. Statins decrease cardiovascular events by 20 to 24%. But the problem with statin is, even after using high intensity statin, there is residual atherogenic risk. So, statins are very useful, but they are not the total solution to lipid management.
All right. So, doctor, moving on to the next question, what is the utility of Pcsk9 inhibitors in India? Since they are available in India now.
Pcsk9 fully humanized monoclonal antibodies. Evolocumab is now available in India. Allopathic is going to be available shortly. The biggest advantage of these agents is that when they are used on top of statins, they decrease LDL cholesterol by another 50 to 60%, and this has been shown in 2 trials, the ODYSSEY outcome and the Evolocumab trial, that they produce an additional decrease in the cardiovascular events by about 50%. So, those patients who have LDL cholesterol more than 70 while on high intensity statins, these agents are useful in decreasing cardiovascular events on top of statins and all other lipid lowering therapies.
Okay. So, doctor, can you please talk about the drug called inclisiran?
Now, inclisiran is a new molecule which is undergoing evaluation. It inhibits synthesis of Pcsk9, small interfering RNA, and it has shown very exciting results in the Orion 1 trial. A single injection of 300 milligram decreases LDL by 50%, and this remains at the same level for 6 months. So, one injection every 6 months will decrease LDL by 50%. So, it is emerging as a competitor to Pcsk9 molecule. Pcsk9 monoclonal antibodies are very costly. This is comparatively a cheaper drug, and head-to-head trial between Pcsk9 monoclonal antibodies and inclisiran are ongoing.
Okay. So, doctor, what is the Pcsk9 vaccine?
Now, Pcsk9 vaccine is a new therapeutic innovation. In experimental animals, it has shown that a single vaccine decreases LDL by 50%, and this remains there for 1 year. The human data is also going to be out within a short time, and if this emerges as a real reality, this will be a booster dose every year, will be the new way to minimize cardiovascular events.
Okay. So, doctor, lastly, I would like to ask, an online platform like Docplexus, how can they help doctors in sharing information? And
see, cardiology is the biggest problem is that information keeps on piling up and coming every day. Some things change, some things become better. So, such interviews and dissemination of knowledge with these, the unique feature of cardiology is that the information comes very fast, it keeps on changing. It is virtually impossible to gather information by reading books, journals or internet. Such interviews and dissemination of knowledge through Docplexus is very, very useful. Within a short time, you can grasp maximum number of new points on new information.
okay. Thank you so much, doctor, for this interview. It was a pleasure having you here.
Thank you.
Thank you.